lot of calcium in the gum tissue too to help keep it healthy. They've seen some things in asthma, cystic fibrosis. Again, it's one of those things where at the cellular level, the body is producing too much sodium, pumping too much sodium out of the cell, which causes that mucus to build up in your trachea and your esophagus. Vitamin D helps to make cells work better, so it's not going to overproduce the sodium or pump the sodium out of cells. So you're not going to have the effects on cystic fibrosis as bad. Migraines, again, a lot of times associated with depression. Alzheimer's, schizophrenia, another, those are brain conditions that have been linked to things like serotonin, melatonin. Vitamin D definitely benefits those. Athletic performance. Vitamin D is important for all your systems, especially muscle function, nerve function, which are probably the two important things, especially coordination of those two systems. In athletes, if your muscles aren't working well and aren't functioning well with your nerves, you're not going to be a very good athlete. Macular degeneration and myopia, especially age-related macular degeneration. Vitamin D, having proper levels of vitamin D throughout your life can decrease that significantly. Seizures, again, especially seizures that have real bad muscle twitching. A lot of that's related to calcium. Calcium is regulation of that calcium and the cells in the body. Again, vitamin D helps to regulate how cells function. If the cells aren't functioning aberrantly, you're not going to have seizures. Preeclampsia, which can be very distressful for pregnant women, will help to reduce that. And fertility. If you're deficient in vitamin D, your body's not going to want to make a baby and make you more deficient in vitamin D. And so, therefore, you won't be having babies. Again, to reiterate, a lot of why vitamin D is so important. Prohormone regulates things at the hormonal level, affects over actually 2,000 genes. Most people are deficient, especially if they're living above 30 degrees latitude, and especially in the wintertime. Helps control calcium, helps control the thyroid. And those couple things really play huge roles throughout the body in multiple systems. Kind of a little picture here to kind of show what happens when the sunscreen, melanin, or latitude of the winter block the sun rays. All these things have malabsorption, increased levels of schizophrenia, autoimmune disease, cancer, osteoarthritis, rickets.
At one point, where it said falls, did it help fall? Does that mean it helps balance?
Yes, well, and that was an interesting one to me. They were saying, yes, it helps balance. The other thing that we see with falls are, a lot of times people, it's kind of like, it's one of those chicken or the egg questions. Did I break my hip and fall? Or did I fall because I broke my hip? Sometimes people, if you're very osteoporotic, you'll simply take a step, your hip will break, and you'll fall. So that alone could reduce your risk of fall. But yes, it does also help coordination. Like we said, with athletic performance, it helps coordination between nerve and muscle. That's going to help your balance, definitely, most definitely.
I know there's a controversy, it seems like, with people who use tanning boosts. And I've debated, is it good or is it bad? And I'm saying, hearing them say, yes, it's good for vitamin D, but yet other people say it's not good. I'm just curious what your thoughts are on that, to get some vitamin D for people this time of year.
Right, and we do recommend the best way to get your vitamin D, because it's the way God made us, is from the sun.
Right.
And a tanning bed is kind of an analog to the sun. It's putting out the same kind of things that the sun is putting out. The problem with some tanning beds are they tend to maximize UVA rays, because that's the rays that get you the color, which is for most people, especially when tanning beds were developed, why people go to tanning beds, to get color. So they didn't really care about the UVB, they wanted to maximize UVA rays, which are the harmful rays. A lot of tanning beds are starting to switch to ones that give you UVB rays as well. The breakdown on natural sunlight coming from the sun, if you said took all the UV rays coming down, it'd be 90% UVA to 10% UVB. That's what you get. And so in 15 minutes, just at 10% UVB, you're getting, you know, that amount of vitamin D production. So you really gotta, you gotta check with your tanning bed, see what kind of tanning beds you're using. There are some products you can buy